One of the areas that's often the most difficult for a healthcare organization to control are premium dollars. And premium dollars occur in a lot of different buckets. You have premium dollars that are occurring because of overtime. You have premium dollars that are there because of agency or traveling nurses or traveling staff. You have premium dollars that are technically outsourced employees that you have through an outsourcing firm. So whether you're outsourcing your environmental services, or nutritional services, those ultimately are premium dollars. You may have premium dollars because you have an interim executive, whether it's an interim CEO, an interim CFO, an interim CO, those are also premium dollars. And then in addition to that, you could have premium dollars for callback pay. You could have premium dollars for individuals that are getting shift differentials and other categories. So all of those elements really are combined to flow into that premium dollar bucket. So when we're talking about overtime, overtime's probably one of the biggest abused buckets. We have incremental overtime, which can build up without even realizing it. We see that with our clients all the time. We'll hear stories about a manager that tells us, I didn't even realize that incremental overtime was a thing. My employees were coming in and clocking out 2 minutes late or clocking in 5 minutes early or forgetting to clock out for lunch. And it's costing my department alone $20,000. I can't imagine what it's costing the entire organization. So overtime and incremental overtime can add up. Pre-scheduled overtime is a second category that we often find is utilized without a lot of control. So if you can really focus in on eliminating incremental, make sure that all of your overtime that's pre-scheduled is actually needed. And then ultimately, if you're using too much overtime, if you get to a certain point where you have 6% of your staff or 8% of your hours or 10% of your hours are overtime hours, but you don't have any open positions, you probably need to start looking at, should you really have those individuals hired onto your staff and recruit someone onto your staff so you're not paying that premium dollar for the overtime.
Yeah, absolutely. We often do that analysis with our clients where we sit down and we say, what is your overtime percent? How are you using your overtime hours? Are you filling small holes? Are you filling complete shifts? And if we're looking at filling whole shifts where we know that, to your point, the pre-scheduled overtime, where we understand that there's just holes in the schedule and they're going to be filled with overtime, well, then that's when we need to take a step back and do that analysis to say, okay, I need X number of FTEs, whether that's broken up into full-time, part-time, per diem, however you want those positions to be, but we need this much coverage and it needs to be more bodies. Because then ultimately, if we're using overtime to fill those holes in the shift, what's going to happen? We're going to have burnout staff, we're going to have staff turnover, and then we're going to be in an even worse situation with overtime utilization. And so it really, knowing when that tipping point is to when we're going to go from using overtime to putting that open position out there, putting the job rec through, and pushing forward with filling the position is really that key to the analysis of taking that step and making sure we review the utilization and the percentage of overtime hours.
I definitely agree with that. And understanding the utilization of agent staffs equally is important, because there is a time and a place for using an agency nurse or a traveler nurse, especially if they're being brought in because you have someone on FMLA, for example, or possibly that you have a peak season of 6 weeks where your staff is going to you're going to need more staff because of the volume for 6 weeks in the summer, because you have individuals coming through your city or coming through your town on the summer months. That would be an example of bringing in agency staff in a way that you can utilize them without actually adding cost for the entire year. But a lot of times we see our clients utilizing agency staff because they're not really proactively predicting when they should recruit individuals to have the right level of staffing for their projected volume levels. And what we know in healthcare is a lot of volume is predictable. We can have those cyclical numbers. We know the peaks and valleys within the months that we tend to get more volume through. We know which days of the week it might come through, and we can predict about 80% of our volume. There are always going to be things that we can't predict, but by understanding those pathways, we can actually determine appropriate use of agency and traveler nurses so that we're not just reacting whenever we have a void.
Yeah, absolutely. Using agency at the right time to bridge a gap, to maybe open a new service line where you're trying to hire in and train new hires to the organization, but we can have agency there that with the experience to help bridge the gap of opening that service line. That is one way to use it in a positive way. The problem is sometimes agency staff sticks around, and they stick around a little too long because they get comfortable, the organization gets comfortable with using them. Well, finance probably doesn't get comfortable with using them. Finance is probably always chirping about getting to the end of those contracts. But I think that we just become kind of comfortable with the fact that schedules are filled, and there's that level of comfort knowing that you have the staff. However, what happens with using those agency is that they often get the first pick of the shifts, they get the special treatment, and the internal employees know they're getting paid more. And so then again, here we go with the turnover. Go back to that theme that I have of, by using these premium dollars, we can lead to turnover of our internal staff. Just magnifying the problem even more.
And then when we're looking at magnifying problems, a lot of times organizations, reach to outsourcing because they're unable to recruit the right members into their team, and or they're looking for expertise that their actual facility doesn't have. And that's a great reason to actually outsource something, because you want to step up the level of service that you have in an individual department. However, sometimes what happens is initially those intentions that were, strong at the front end of the project end up getting lost 3, 4, 5, 6 years later. And not only are they lost 3, 4, 5, 6 years later, but it's in a situation where they now have lost sight of why they did it in the first place. So I think it's important to always understand, why did we outsource? Why did we bring in those premium dollars? And are we still getting the actual benefit that we thought we were going to have from that contract, from that management agreement, from that company, so that you can actually still root in on the actual reason the determination was made for the contract, and properly vet whether you should continue down that pathway.
Yep, I like to tell our clients, each individual manager, that they should run their department as if they're the CFO of their department. So always understanding that root reason why we brought those agency staff in, why we're using so much overtime, why we're outsourcing what we're outsourcing. Those questions need to be asked routinely. If it's not every week, every month, maybe every quarter, but they need to be reviewed so that there can be control over them.
Such a great point. I definitely agree. Looking as you're at the CFO of your department is the way everyone should really manage their resources.